So welcome back friends, welcome back in another video tutorial. So today we will going to discuss about the treatment of the Staphylococcus aureus. So we have discussed we have just completed our lecture on the pathogenicity of Staphylococcal aureus. We have learned how Staphylococcal aureus by entering the skin causes various types of complication, right, and also produces 5 important super antigens, right? We have also talked about this. So now it is time to talk about the treatment of Staphylococcal aureus. So the one and only treatment for Staphylococcal aureus is antibiotic, no doubt about this. But there is a problem, because Staphylococcus aureus have the ability to adapt very quickly. Okay, and as a result, nowadays most of the Staphylococcus aureus strain developed antibiotic resistance to a number of important antibiotics. Okay, so previously we can treat Staphylococcal aureus with penicillin. So now I will go back to the picture that I have used to explain the mode of action of penicillin. So this is the picture. I hope you can remember if you have watched the cell wall synthesis inhibitor lecture video. So penicillin, so this is the cell wall of Staphylococcus aureus. Okay, so penicillin, what penicillin will do? Penicillin will bind with this penicillin binding protein, and especially in case of Staphylococcal aureus, it will causes the disruption of this transpeptidase enzyme. Okay, so this transpeptidase is a kind of PBB protein. Okay, so this kind of PBP is in charge of cross-linking the long strands of amino polysaccharide. Okay, so that means, in simpler words, this transpeptidase is responsible for the cross-linking, which ultimately leads to the formation of peptidoglycan. Okay, so if transpeptidase will not work, cross-linking will not occur. Okay, and as a result, it will causes the cell wall to become leaky. Okay, so how cross-linking is going on, let's see. So peptidoglycan is consist of two polysaccharides, N-acetyl muramic acid and N-acetyl glutamic, that is our NAG, that is N-acetyl glutamic sorry. So NAM, the full form of NAM is N-acetyl muramic acid, and the full form of NAG is N-acetyl glucosamine. Okay, so I am confusing it with N-acetyl galactosamine, but this is no, I have it is N-acetyl glucosamine. So peptidoglycan is consist of two polysaccharides, that is NAM and NAG. In turn, you can say that peptidoglycan is a polysaccharide of two important saccharide. There one is N-acetyl muramic acid, another one is NAG, and they are arranged in an alternative form. That means, suppose if this subunit is NAM, then the next one will be NAG, and this will be NAM, and this one will be again NAG, and this one will be again NAM. Okay, so in between them there will be pentapeptides or tetrapeptides. Okay, and in between them, or these peptide chains will form a linkage with another peptide chain of the neighboring strands. Okay, so this linking is facilitated by a process called transpeptidation. Okay, and this transpeptidation reaction is mediated by transpeptidase. And now try to think about, we have applied penicillin, so penicillin disrupts the transpeptidase. So can the transpeptidase reaction will still occur? No, and as a result the cross-linking will not occur. Okay, which prevents the formation of the peptidoglycan cell wall. okay, and ultimately leads to the death of the organism. Okay, so that is the normal mechanism by which penicillin used to work in case of Staphylococcus aureus. But it is unfortunate that nowadays near about all of the Staphylococcal aureus strain have developed beta lactamases. So what is beta lactamase? Let's go back to the picture. Beta lactamases is an enzyme that Staphylococcal aureus may have acquired from plasmid or any kind of thing, so that have the ability to destroy this beta lactam ring. Okay, and we all know that penicillin is the beta lactam antibiotic, and as a result it cannot show its activity no longer. Okay, so due to the capability of beta lactamase production by most of the Staphylococcal aureus strain, now it is become impossible to use penicillin for Staphylococcus aureus treatment. Okay, so what to do under such circumstances? So we have already discussed when we have talked about amoxicillin that there is a inhibitor of beta lactamase, which is clavulanic acid. Okay, this clavulanic acid will bind and disable the beta lactamases, so we can use penicillin with clavulanic acid if we want. Okay, and nowadays we have also developed a new kind of beta lactam antibiotic named methicillin, okay, which is not easily destroyed by beta lactamases. Okay, so it is a modified version of penicillin, you can say. So this kind of things cannot be easily destroyed by lactamases. So that is the part 1 of the treatment of Staphylococcal aureus. We have not talked about another kind of Staphylococcus aureus strain that have developed resistance to methicillin also. Okay, and in the next video we will going to discuss about those strains. Those strains are known as methicillin resistant Staphylococcal aureus or MRSA. Okay, and we will also going to discuss about VRSA, and that is the vancomycin resistant Staphylococcus aureus. Okay, so in this video we have learned that we are using Staphylococcal aureus, we are using antibiotic for Staphylococcus aureus treatment. Okay, mainly we were using penicillin in earlier days, but as penicillin now no longer effective, we have to move towards methicillin. But later we have also learned that we cannot use methicillin also, because some of the Staphylococcal aureus strains unfortunately also develops resistance to methicillin. Okay, so how penicillin causes destruction, or I should say now that how penicillin used to causes destruction of the Staphylococcus aureus cell wall. So penicillin will disrupt the DD transpeptidase, okay, which is an enzyme which was responsible for the cross-linking in the cell wall, which facilitates the formation of peptidoglycan cell wall. Okay, and peptidoglycan cell wall consists of what? Peptidoglycan cell wall consists of two saccharides. One is our N-acetyl muramic acid, and another one is our N-acetyl glucosamine. Okay, and in between them there will be tetrapeptide and pentapeptide cross-linked via a process called transpeptidation, and which is facilitated by the enzyme transpeptidase, that is actually inhibited by penicillin. Okay, so that's it for today. In the next video we will going to talk about the MRSA.